Thanks for joining us today. I'm Jen Harris with Montgomery County, and of course, we have here Dr. Bissell. She's here to answer any questions you may have. If you have any questions, we ask that you please use the chat or the Q&A to ask those. And again, thanks so much for being here today.
Yeah, Jen, thank you so much. Thank you everyone for joining. I don't really have anything prepared. So please, if you have questions, happy to go ahead and answer those. Obviously, cases are still pretty high related to our Omicron surge. Because of the sheer numbers, we are still seeing our hospitals under significant strain. But the data really does show overall that, number one, the vaccines are still very protective against severe disease, hospitalization, and death. And number two, that Omicron doesn't seem to get into the lungs and cause the degree of severe disease that especially Delta had done. We had a new governor inaugurated over the weekend, and so we do have some changes, and there's a lot going on this week. And we'll do our best to navigate these times as there are changes coming. So I don't really have anything prepared, but I'm happy to go ahead and take questions.
Okay, right now we have one question in the queue. Oh, we have two now. Our first one's coming in from Eric. There's a bill in the General Assembly right now that would allow people to become health directors without needing to be a physician. Do you think this is a good idea? And also, are health districts having trouble finding doctors who want to be directors?
So I think the biggest thing with finding health directors in the state is where some of our districts are located. For instance, I'm covering Mount Rogers, Cumberland Plateau, Lenawisca right now, in addition to New River Valley. And those are more rural health districts. And so it takes somebody who's been in a rural area or who knows about a rural area. Obviously, someone who's interested in being in a city, a more urban area, suburban area, is not going to be happy in those areas, although those are some of our most needy areas when you're talking about public health. As far as whether or not a physician I think it's fine if there are people who have the advanced degrees and knowledge in epidemiology, public health, those kinds of things. I will say that having experience means a lot when you're talking about managing public health. So for instance, I don't have an MPH. I have an MD. I have 30 years of clinical experience in a variety of settings in which I have learned a lot of on-the-job public health. So I did hospital work. I've been out in the military. I've been civilian. I've done outpatient work. I've done college health, and of course now doing public health. And in each of those settings, I could give you plenty of examples where I essentially had on-the-job public health training. Right now, I have a team of MPHs in my epi team that really does take over with, they help, and we meet regularly, we discuss regularly, talking about the data, talking about trends, talking about what we need to do to manage this response. So I think you've got to have all of those degrees in the mix, whether the director has to be a physician. I don't know that necessarily has to be, you certainly need someone with an advanced degree, but there has to be a physician who's got some clinical knowledge and in the knowledge, because we manage infectious diseases, we manage medical situations. So, there are ways to do it, but I think you have to have a physician in the mix, just like you have to have people who have masters of public health, you have to have epidemiology experts, and you really have to have a leadership team that can communicate on all of those things to manage any kind of a public health response.
Thank you for that. Jean has a couple questions. First, are you concerned about case rates in schools going up in light of Governor Youngkin's executive order about doing away with the mask mandates?
So, I think we've gotten used to the masking, and You know, we've said we didn't see a lot of transmission in schools because of masking. Obviously, given this change and a lot of conversation around it, I spent a lot of time this weekend, and I've looked this morning, and you can actually go to the CDC website, and you know, there's pretty common knowledge about states that have mask mandates and states that don't have mask mandates. And if you look at the data, the data doesn't differ significantly. And so in the context of Omicron's everywhere. We know Omicron's everywhere. We know transmission happens a lot at home in the household. We know transmission happens a lot in social activities where people carpool together, they have sleepovers together. Certainly transmission can and will happen in schools with Omicron. But I have to say that looking at the data, my level of concern did go down, that if masking does become optional, it may not be the disaster that people are concerned it will be. If you look at the data between states that have mask mandates and states that don't have mask mandates right now. So, you know, I think we need to look at that data. We need to discuss with the Department of Education, Department of Health. We need to look at, you know, how we're going to move forward. And I think the other thing to consider is obviously Senate Bill 1303, which said that school, you know, in addition to the public health order that governor, or that, I'm sorry, then Commissioner Dr. Oliver put out requiring masking in K through 12 schools. Senate Bill 1303 says that schools need to offer in-person instruction as safely as possible, and in doing so, you know, they need to adhere to the greatest extent practicable to CDC guidance. And of course, CDC guidance right now is still for masking. So there are a lot of things that need to be ironed out if and when, you know, any changes to the current masking policies take place. The other thing is, you know, quarantining and contact tracing in the schools. You know, the typical definition of a close contact was within 6 feet for more than 15 minutes cumulatively over a 24-hour period. In schools, we kind of got that exception between 3 to 6 feet, not considered a close contact, as long as, you know, the involved parties were both masked. So things would change there. You know, I will say, you know, states like Minnesota have gotten rid of quarantining in the schools, and a lot of the states that obviously don't have mask mandates have gotten rid of quarantining in the schools. And there are some public health folks who say that, you know, the sheer numbers of really investigations are contact tracing, and just because of the sheer numbers, I mean, I think every district in Virginia will tell you, districts nationwide will tell you that the sheer numbers, there's no way that we can make contact with every single positive. And, you know, we kind of go into that surge strategy where you know, you put it out there that people who are positive, please notify your contacts. People who are positive, people who have symptoms, please stay home and isolate, and, you know, and follow this guidance. So I think there's definitely going to be a lot of discussion this week, so that by next week we should have some better guidance on what we're going to do.
Okay, Jean has another question here. How is the New River Health District doing at this point in terms of test supply and demand for testing?
So demand has definitely gone up. You know, we never stopped testing. We have our partnership with Fralin, and we never stopped testing. It is the PCR test that we offer. In the past couple of weeks, since we've kind of hit that Omicron surge, whereas we had been doing a handful of tests a day, we're easily doing, you know, on some of our days, 100 a day, even in some of our outside district offices. So like out in Floyd, out in Giles, those areas, Pulaski. So we are definitely seeing an increased demand. We offer the PCR test. Everyone wants the rapid test, and we don't have the rapid test. And we all know that rapid test is scarce. I think the government has put out that tomorrow covidtesting.gov, I think, is the website where people will be able to go to request tests, up to 4 tests per person to be mailed to them. They're going to be releasing a phone number, but I don't think that phone number has been established yet, where the federal government will mail you tests. I do think they are becoming a little bit more accessible, where people can order them online, and you might get lucky to find them in our pharmacies. I do know our schools that are participating in the VISTA program do have access to rapid tests, but the health department, we just don't have a lot of rapid tests. We're working very closely with our jails. We're working very closely with our residential treatment facilities through our community services, to try and secure testing for them, because they really need them in those congregate settings. But we do have testing available. Our PCR testing is normally next day results. Obviously weather may impact that, but so for instance, the test that we're doing today, we should have those results back tomorrow evening. Now, we're working to try and find ways for automatic notification of results, because obviously when you have more people that get tested, getting those results back to those people is challenging, and we have to be compliant with the HIPAA guidelines. So we are really working diligently to try and find a way that there's automatic result notification. There's been a lot of glitches because our testing system, we use one computer system, and the automatic notification system is another computer system. And so we're trying to figure out how we can upload, download, and how those can communicate.
Okay, it appears we have about 3 questions left in the queue. So if anyone has any questions, please use the chat or the Q&A to ask those. Our next question is coming in from Nick. I know case numbers are still elevated, but are there signs that the district may be rounding the corner in terms of this new Omicron variant that we're dealing with?
Yes, there definitely are. And I would say look at some of the places that hit their Omicron surge before us. If you look at like New York, for instance, their cases are dropping significantly now. Even the state of Virginia, there's some encouraging signs that maybe the state overall has kind of hit that peak and started to come down. And our epi curves will be on the website for this week, but our current epi curves show that we still are trending up, but that rate of increase is much smaller, which suggests that we're kind of hitting that peak. So we do fully expect that, our peak is this week, and then we'll start to see cases decline over the weeks after. Generally these curves, the way they go up is the way they come down. So when they go up pretty steeply, as the Omicron surge has, they should come down pretty sharply as well. And that's exactly what you saw in South Africa. That's what happened in England. And that's what we're seeing in New York and some of the more densely populated urban areas in the country, where the cases are dropping pretty remarkably over a shorter period of time.
Okay, Jenny's asking, now I know we just talked about how demand for testing has increased, but she's asking, have you heard of an increase in people having symptoms of COVID, but they don't want to get tested, maybe because they are afraid to admit that they have COVID? And what is your advice to folks who may find themselves in this type of a situation?
So I would say that there are definitely people who don't want to get tested. and that's been the case all along. A lot of our migrant populations early on, they didn't want to get tested because then they couldn't work. And these are wage employees. If they can't work, they can't put food on the table. And so they just went from one place to another. You probably remember, the poultry plants had outbreaks, the construction sites. And what we found is that workers would travel. So if there was an outbreak and a construction site kind of got shut down in one area, they'd end up going to another one. So there are definitely reasons that are disincentives to some people to getting tested. So you have those people who really want to get tested, and then you have those people who definitely don't want to get tested. We know that for a lot of reasons, the availability of tests, people not wanting to get tests, that there are far more cases than we're documenting with positive tests. And people doing testing at home, a lot of them are not self-reporting those results. We know that. So, so I think it kind of comes back to what we're saying is, if you're sick, stay home. right? We know there are other things that cause very similar symptoms. There's COVID, there's respiratory syncytial virus, there's flu, there's other coronaviruses causing common colds and very similar things. So, you know, something that should kind of go well beyond this pandemic is that, you know, we need to know, especially with these diseases, these viruses that are transmitted respiratory wise, that when you're sick, please stay home. So you're not exposing people at work, at school, out in the community to whatever infection it is, because, you know, we talk about these things being mild for certain people, they might not be so mild for somebody else. So, you know, it's certainly, I think it's really important if you're symptomatic, or if you know you've had an exposure to someone, if someone says, hey, you know, I tested positive for COVID and we had close contact, you know, please stay home, quarantine, follow those guidelines. And that's the best way to protect the other members of the community.
Okay. Eric is asking for a clarifying question to talk about the districts that you are covering in addition to New River Health District. Could you please explain that?
So I'm covering New River Health District, and then Mount Rogers, which is down 81 to the Tennessee border, includes Wytheville, Smith County, Grayson County, Bristol, Galax, that area. And then I'm covering far southwest, which is Cumberland Plateau and Lenawisco. So Lee County, Scott County, Wise County, City of Norton, Buchanan County, Tazewell, Russell County. So pretty much everything from here, you know, directly south and west is what I'm covering right now.
Thank you for that. There appear to be 2 more questions in the queue. So again, just reminding folks, if you have any questions, please ask them in the Q&A or the chat. Nick is asking, so to follow up on his last question, which was talking about case numbers and if we're rounding the corner or what have you, could you talk a little bit about hospitalizations? They lag a bit. So what is it looking like for us, and what do you think it's going to be looking like in the next couple of weeks?
So hospitalizations do lag behind cases. We know that. So hospitalizations are up. You know, Ballad is the main healthcare provider for Southwest, and I've been following their numbers for quite some time, and their numbers are certainly up. They aren't quite where they were back in January of 2021. I think they had cases that were over 500 in the hospital then, and but they're up. They've passed where they were with Delta. So they're definitely increased again. I think their intensive care unit and their ventilator unit numbers aren't quite like what they were with Delta. But again, you know, as we talked about, something that's so much more transmissible, even if it doesn't cause as severe disease, just by the sheer numbers, you can end up with more people in the hospital. You can end up with more people needing intensive care, more people needing the ventilators. For Virginia, VHHA, we're definitely seeing an increase in VHHA, which is all of Virginia hospitals. Their numbers are higher than they've been at all during this pandemic that I've seen. Our local hospitals, HCA and Carilion, are definitely seeing numbers comparable to or exceeding where they were earlier in the pandemic back in January. Now, one of those things with hospitalizations, and I'm sure people have seen data, is, and I don't have a good breakdown of that from Ballad, and I don't have a good breakdown of that from HCA or Carilion, is how many people are actually hospitalized for COVID versus hospitalized for other conditions and have COVID, because they test everyone coming in for COVID. And some of the data out of New York and other places said it could be as much as 40 or 50% are hospitalized with other conditions and found incidentally to have COVID. And so as we've transitioned from Delta to Omicron, that's more likely could be the case, right? Because Omicron may not make folks quite as sick. But again, as I said, just the sheer number of cases, you can have more people hospitalized. So we don't have that breakdown in data. I do think our new governor has made it a priority to try and get that breakdown in data, how many people are hospitalized with it versus for. The one thing that we do know is still that, the majority of people are unvaccinated who have the complications and end up in the intensive care units and on the ventilators from COVID, our unvaccinated population. So again, we do know that the vaccine protects against, even though there's a lot out there that people who are vaccinated are still getting COVID, it's still very, very protective against severe disease, hospitalization, and death.
Okay. Leanna has a question now. In the fight against COVID, what's working well at VDH? And in the work that VDH is still struggling with, what resources would be helpful?
I think that the biggest challenge right now is what's working well is I think, and I can speak for my district and for the other districts that I'm covering. I think we have good relationships with our schools. I think we have good relationships with our community partners, and hopefully, good relationships with our community, that people still do look to the health department for guidance. I think we have, tried to meet our communities where we are. That's traditional public health. Try to meet them where they are, because it's not always going to be perfect. They for whatever reason can't always do what we recommend that they do, or we want them to do, or what the guidance says. So I think that has worked very well at the local level. I think the biggest challenge right now is the sheer numbers of cases. Again, there's no way that we can reach everyone. You have to have a degree of control and oversight. So people say, oh, you have money, hire more people to do the case investigations and the contact tracing. And there's you have to have some degree of what we call span of control and oversight. And there's no number of people that you can hire to just handle all of the cases right now. So that's where having that relationship with our partners and our businesses and our schools is really important, because we can kind of keep the guidance flowing, we can make our recommendations, and we can help out there. What resources do we need? I think, public health staffing in general, when public health is working in the background, people don't realize it, right? So when you can go out and eat at a restaurant and it's safe, you don't realize that that's because of public health and doing the restaurant inspections and making sure that the regulations are followed, that you have safe drinking water, that's because of public health, that we typically don't have huge outbreaks and pandemics like this. And, we deal with communicable diseases all the time. And, case investigation, contact tracing is not something new. We do that all the time. And in most cases, you're able to contain things. And so people don't realize that we had this outbreak of whatever, or that we prevented an outbreak from becoming much worse. We do a lot of investigations. We do post-exposure prophylaxis. We get people connected to treatment, those kinds of things, and we reach our most vulnerable populations. But over the years, when public health is working, that's one of the first budgets to get cut. That's one of the first groups of staff to get cut. So we've continued to, I think, do a very good job in public health with decreasing budgets and decreased staffing. And then, of course, you put the pandemic on top of it. And our public health staff are taxed to the limit, and they have been for 2 years now. We went from a very fearful, anxious population, and we always get the brunt of that fear and that anger when people are upset. And so my staff they've been doing it for 2 years, and all the other public health stuff hasn't gone away. We've done our best to keep up. There's certainly a lot more to do, and we're going to have a lot of catching up to do. So certainly the resources we need, I think, is building that public health infrastructure to make sure that we're more prepared, And then I just think continuing with the campaigning that we need to show each other grace and kindness, and we need to understand that judging people is not helpful, and we've become so divided and so judgmental, and people with differing opinions and differing views, and traditional public health is about meeting people where they are, about trying to educate them, about trying to help them find what's best for them, for their families. And I really want to get back to that. And it's challenging. I'll be very honest. In today's world, with politics and with the media and with social media, it's been extremely challenging. And when we're so divided, we've got to find that balance. We've got to find that middle ground. We've got to be able to compromise. And so those are the things I think we need the most. And I'm very proud that my staff, I think, has done a very good job in trying to find that and meet people and still serve their community through the most challenging times, and the most divisive times. And then you put a pandemic on top of it.
We have another question from Tom. You mentioned health inspections for restaurants. Obviously, the pandemic has to take priority, but have inspections continued over the past 2 years?
So they were paused briefly. We did a lot over Zoom, and we, with the public health emergency orders and whatnot, and restaurants being closed down, we weren't going into restaurants because that was part of the order, that we were not going to go in. And so our environmental health staff got very creative, and they really helped guide people over the phone, over Zoom, virtually. But we are going back into restaurants now, yes. And we have been, I would say, for probably the past year. I think the first year was when things were really kind of, had really cut back. But we are going back into restaurants and trying to get people, back up to, when you don't have the health department coming in, things tend to, slack a little bit. And so now we're trying to get people back up to speed. Hey, we got to remember we have to do this, we have to do this. And we're working with people, with our restaurants, on plans to make sure that we are, pretty much up to par with all of the regulations and food safety.
Thank you for your time. Thank you for answering all the questions. That appears to be all that we have today, and we look forward to the next time we can get together. Have a great day.
Yeah, I think we'll plan next Monday, right? And hopefully
Sounds good.
We'll have a lot more answers next Monday. Thank you so much, everyone. Thanks, Jen.
Thank you. Have a good day.
Bye-bye.